strongly disagree are on Band 8, Band 8A, Band 8B pay as a staff nurse.
With BCRemit, sending money to the Philippines is as easy as 1, 2, 3. First, download the app from the App Store or Google Play Store. Launch the app and click the sign up button to get started. Enter your email address, create a secure password, and click Create Account. To ensure that we get your money safely to your beneficiaries, we are going to need a few details. Enter the necessary information, then choose your preferred delivery option. Finally, enter the amount you want to send. Choose your payment method and press send. It's that simple. Secure, fast, convenient. Send money to the Philippines now for as low as $2.99. Send love the BCRemit way.
Hello, Manong George here. Welcome to our channel. And today we have a very special guest.
My name is Kier, Kier Arvin Pagpangdumo, and I'm currently working as a home manager, but on Monday, I'll be starting my new role in the company as regional director. So I'll be looking after 5 homes, and I'll be overseeing it from commercial and operational point of view, ensuring that the home will be profitable as a business, but also the quality of care that we're delivering is up to standard. So yeah, and I'm a nurse by background. I qualified in 2010, came to the UK in 2012.
Man knows best.
As I've said before, I used to work for NHS. I've worked for, I think, less than a year. And when I decided to move from NHS to care home setting, my colleagues were just saying, are you ready to retire? Because care homes are just for people or nurses who are ready to retire because there's nothing to do there.
I have some bad news. Oh, I have some good news.
Actually, working in a care home can be more challenging than those who are working in a hospital, because in a care home, as a nurse, you're in charge of the whole unit. You don't have doctors, you don't have ancillaries. The ancillaries you only have are the domestics, activities. They're not trained clinically. So everyone's relying on the nurse in terms of making the clinical judgment for the welfare of the residents. You could only call the GP for medical advice, but ultimately, you're the one in charge in ensuring that the shift runs smoothly. So yeah, there are really good challenges in care homes because the nurses has the sole autonomy in ensuring that the residents are safe and looked after well.
Man knows best.
Ratio is what? 1:20, 1:22, but you have care assistants and senior carers working alongside you as well, and you are protected by the policy as an umbrella of the company. So we have systems in place to make sure that it is safe for the nurse to look after this amount of residents. But you also have the clinical lead, your deputy manager, and your general manager who could help you with that. So I think in terms of the needs of the clients, these are just para kasing rehab, or as you work in a care home setting, you would get to know these people. Unlike hospital, people would always be forthcoming and they are unwell and they would just come and go. So you might build that rapport with them, but it's only short term. Whereas in a care home setting, these people who are the resident will be there for God knows how many years if they are looked after well. So for example, in my care home, there are residents who's been there for 5 years. And as a nurse, you develop this relationship with them. You get to know how they want their things, their preference. So it will be easier for you to deliver the care that they really need. Some of them are still walking, they're still independent. They just need assistance with preparing their medications, and they will take it on their own. So yeah, it really depends how or ano yung kinikater ng care home. For example, because there are care homes that are really heavy in terms of clinical leads ng clients, but there are care homes as well that are just residential care, but there's a nurse there because their registration is a nursing home rather than residential care home. So it really varies depending on the registration of the care home with CQC.
Man knows best.
So yeah, the support is there because, for example, with my company, we have our own clinical development department and learning and development department who are only in charge in developing people, like what I said, supporting nursing associates, overseas nurses in achieving their full registration with NMC. So that's part of our program in ensuring that we develop our staff and people.
Man knows best.
I strongly disagree because when I was with NHS, I was there for 9 months, and my colleagues has been there for like 5 years. They've been working more than 5 years, 9 years, 10 years, and they were still on band 5. And the main reason I went to the care home sector is because of progression, because progression is really easy if you perform well, if you demonstrate that you have the right skills, you have the right attitude, you have the right knowledge and competencies. The company will support you if they see that in you. For example, in my case, I started as a nurse in a care home, then I became clinical lead, I became a deputy manager, I became home manager, I became clinical standards inspector in the company, and now I think I'm the first Filipino in the company. We have 80 care homes in the company in UK, and I think I'm the first Filipino to do the regional director role, and I'm starting on Monday, and everyone in the company is buzzing and overly excited for me to start the role. So yeah, progression is there if you want to, and I know many Filipinos as well who's progressed from being care assistant up to a home manager level, and they're not nurses themselves. Also, equally, there are nurses who started as a staff nurse, and then now they're nursing home managers. So the progression,
Man knows best.
the pay is really well because we don't abide by the NHS agenda of change pay scale. We don't do banding because it's a private equity company, so we could decide the salary for the nurses. For example, the nurses in my care home, they are really paid well. They are on band 8B for a staff nurse job that they're doing. Because I think the rate of nurses in any the same rate that our care assistants and senior carers are having, whereas our nurses are on band 8, band 8A, band 8B pay as a staff nurse.
Man knows best.
I think what my advice is just, I think care home sector is not for everybody. If you feel that it's not for you, then don't go for it. Because if you're just doing it because that's your stepping to get to UK, you might as well just go to NHS the moment you landed in, because you're not going to enjoy the job if you feel that it's not for you. But if you feel the care home sector is for you, the opportunities are endless. If you demonstrate you have the right attitude, you have the right skills, you build this good rapport with your colleagues, with the residents, with the families, companies will invest in you as well. And if you like progression, opportunities are endless as well. And take it from me, who has started as a nurse in a care home and now working as regional director for operations within a large organization. Care home setting for nurses is a challenging setting, but I think the fulfillment that you get when you see the smiles from your residents that you're looking after, and the relationships that you forge with the staff, with the families, and ultimately the residents, it's that reward that you get that's not comparable to any amount of money.
Always remember, Manong knows.
Man knows best, put your worries to rest when staying in the United Kingdom. Man knows best.